I'm a Mo lead and I'm a security liaison nurse, and behind me is Avebury Ward, which was our low secure COVID ward. So when patients were swabbed and tested positive for COVID-19, they were then moved to Avebury Ward.
I was living in Spain on and off for 12 years, and I took over a bar, restaurant, last few years. I had it, and yeah, I had to give it up because of COVID. I had to go, I had to leave. So for me, it was just a choice to make. So I left everything behind and came over here. At first, like, feeling like a big downfall, because you're like from bar owner to toilet cleaner, like. But then the respect and recognition from the people that you get at that time shows that it's completely different, that you play a very important role. Like a barkeeper, you're trying to make people happy, but somehow it's in a different way. It's like an honest smile you get here. In a bar, it's more like a drunk smile. You know, I mean, you make people happy, but you're having a bit of fun. But here you can see you can make a difference to people. I didn't even fear that situation to go into COVID area. I just felt like I just had to do it. Just do it. It was like they go to the toilet. I was after them with a bucket all the time. Yeah, because you have to. You just helped each other, and without even asking them it. It just clicked. I love it.
I normally work in the Court Liaison Diversion team at Westminster Magistrates Court, and I suppose in the build-up towards lockdown, I was aware that it was quite likely that I would be asked to come and work on the wards, and that's happened, I think, about a week after lockdown started. Normally we're always kind of encouraging patients to maybe not be in their room and socialise and to kind of promote independence, whereas it was kind of totally different because people were COVID-19 positive. We were asking them to isolate in their rooms, and that we were doing everything for them. There was a time where it felt like the work was just building up, more patients were becoming sick, and everyone was just really focused and had a really good attitude. I feel really proud of working here, I feel really proud of the people I worked with, really proud of the patients. I think they did amazingly well.
I'm a third-year nursing student. I was working on the ward which the majority of the patients came from. So they were escalated up here after they tested positive, and I looked after them on this ward. People had been redeployed from other areas, other wards, so it was quite interesting to see the mix of different people and their skills. We knew that we just had to sort of get on with it, and we had to care for the patients. We needed to make sure that they were well and they would recover and come off the ward. So everybody chipped in and helped each other and worked together. It was a really, really great team. The PPE was difficult in the beginning because we weren't used to wearing it, and also communicating with the patients as well. So you have to just make sure that you're speaking a little bit louder, a bit clearer. It just took some adapting to.
I'm a nursing associate apprentice working within Broadmoor Hospital. During the COVID-19 crisis, I've been redeployed in Avebury Ward as a healthcare assistant. So I thought, you know what, I'll see where it goes and I'll try it out, and you know, I thought I'll help out a little bit at the end of the day. I don't think I was worried the fact that it was a COVID ward. I was worried about working with a new team. We had a really good mix of people of different disciplines and varieties and different sectors within the mental health and within the trust altogether, and actually worked really well because people are willing to walk the extra mile and they just actually did things. And when things were in need, people just stepped up and sorted things out. I learned a lot of more, I say, interactive skills or between patients and the staff, because we had to work with people that work a very different spectrum, and they brought in so many different expertise into the pot, and then you know, you mix it and this is what you get. That was Avebury Ward. And I really learned to pick up whatever you can in the given situation and make the best out of it. I probably built a little bit self-confidence from working here because I think that, you know, my skills were useful and relevant. We're different people from different places, never seen each other. shop together and like, good luck, have fun, you know? And we made it work.